It is time for the injury report presented by Florida Orthopaedic Institute in partnership with Tampa General Hospital. And joining us on the hotline for the first time is Dr. Trey Remaley. Thank you, Dr. Remaley, for joining us today.
Of course, gentlemen. This is awesome. It's nice meeting you guys.
Did you have to wrestle Dr. Selman for this opportunity? Because I feel like he just wants to hold on to it for himself.
He does, man. He really enjoys this, but luckily he stepped away so I could step in. I appreciate it.
Well, we're happy to have you, Dr. Remaley, and I know how busy your schedule is, so we really do appreciate it. And let's get started here with Tua Tagovailoa. We all know the whole world's been talking about the scary head injury that he suffered, the concussion. Really, he had a couple weeks ago, and then last week we saw it again. And last week is when we saw what they call the fencing response, where his fingers were kind of contorted in front of his face. Dr. Remaley, what happened there?
Yeah, so this is a pretty significant injury, and he also had the injury the week before, the game before, and I would appeal to concussion management, to my primary care sports medicine colleagues, Dr. Selman and Dr. Moran and everybody that we work with here. But the fencing response is the true name for it is an asymmetric tonic neck reflex. And it happens when the soft tissue of the brain kind of impacts the hard bone of the skull, and you kind of bruise the gray matter of the brain. And what happens is it kind of stuns it, and it loses the control, and so the brainstem kind of takes over. The fencing response is a normal kind of reflex in brain development, and usually it's seen as a normal development in infants up to 4 months of age. But when we see it in athletes like this, it's a sign of a concussion and a brain injury that definitely needs to be treated and monitored.
Yeah, Doctor, the Dolphins came out this week and said Tua Tagovailoa won't play on Sunday, to which I thought, yeah, no kidding. Like, I can't believe they're even, like, it's even an announcement. I expected it personally, not that I know a lot about concussions, but just seeing that reaction, reading some of the things that I've read from experts since, to me it seems like something that they should keep him out for quite a while. Is that your sense? Do you think this is something that we might see him in a week or two, or because of that response and like you were just talking about, an actual brain injury, a brain bruising, do you think they should keep him out for, a month or even more?
Yeah, it's hard to say with concussions because unlike, x-rays that I get and we can see fractures and we can kind of determine a timeline, there's no imaging that gives us an idea of the severity of a concussion. And so they undergo pretty much, I would imagine, every day getting evaluated and watching the progression. And there's certain things with rehab and therapy and different things like that they can do to help stimulate the recovery. But there is really, with a concussion, there is no defined timetable for return. And even mild players that get mild concussions, can be out several weeks, and so it's really hard to determine a time frame of return. It's really watching his progress and things over the time. So it could be 2 weeks, it could be longer than that. But it seemed to be a pretty significant injury. But again, I didn't evaluate him or anything like that. So.
Dr. Remaley joining us right now on the Pat and Aaron Show, and we saw Jonathan Taylor go down. He's going to miss this week with what we heard is a high ankle sprain, and we know those high ankle sprains, that's where the real problems come in, the dreaded high ankle sprain. So he could be out even longer. Can we just talk about the difference between ankle sprains, the high ankle sprain, the low ankle sprain, and any other injuries to the ankle?
Yeah, so, if we start with a low ankle sprain, it tends to be more of the ligaments kind of below the bones of the ankle, the fibula, the tibia, and things like that. And it's pretty common, amongst athletes to have a low ankle sprain. And usually the return to play from that can be quick, a couple weeks or things. But a high ankle sprain involves ligaments that are higher up in the ankle, kind of above the ankle, so to speak. And these oftentimes are pretty more significant than a low ankle sprain. And it involves a joint area called the syndesmosis, and there's 4 or 5 ligaments and structures in that area that are involved in the stability of that. And so these high ankle sprains can take longer, upwards of 6-8 weeks potentially for a return to play, or even longer than that, depending on how they're recovering and things. And so with the pro athletes, and they've obviously got a lot of access to higher end therapy and rehab, but I would speculate that he'd probably be out a couple weeks.
So is it the case, maybe I'm just reading this wrong, but is it the case where it takes longer for that high ankle sprain to heal, not because it's maybe a more severe injury, but because it impacts more components around that ankle?
Yeah, it does, and that's an area that helps stabilize the ankle. And so you put stress and trauma through that area, it can take on a lot of issues, stress and strain, and the biomechanics get a little altered. And so it can take a lot longer for those to recover, and it can be challenging to treat and very frustrating to return from.
Cowboys wide receiver Noah Brown, he injured his neck last week in the fourth quarter, and he was seen favoring his arm, and a lot of people thought it was just a stinger here. So I want to, we see that a lot in football especially. What's the difference between a stinger and a serious neck injury? Like, how do you know between one or the other?
Yeah, so you really assume kind of the worst when they're coming off the field, and you want to get an evaluation and really talk to the athlete, and they'll tell you, kind of more of what happened in what position. But a stinger or a burner, sometimes as it's called, is an injury of the brachial plexus, which is a group of nerves that leave the cervical spine and goes to the arm. And so in a stinger, those get stretched or compressed, from their hits or tackles or whatever, and causes a sudden feeling of lightning bolts or electricity running through the arm and almost kind of a dead arm. The good thing about stingers usually is they can resolve pretty quickly, and we'll do serial evaluations or repeat evaluations on the sideline, and 5-10 minutes. If the athlete can prove that they've got full range of motion of their shoulder and their strength is about 90% of what the other side is, generally they'll be able to return to play. Neck injuries tend to provide more significant nerve injuries to the arm, whether you've got weakness or loss of motion, and those types of things tend to linger longer than what we see with a quicker recovery on a stinger.
Julio Jones returned on Sunday night for the Buccaneers, but was very limited due to his knee injury that kept him out before Sunday, and Todd Bowles basically said after the game that he just never loosened back up after halftime. At this stage of Julio's career, at his age, is this something that's just going to be an issue for him moving forward, or is it the kind of thing where shutting him down for a few weeks could mean having him at the best we could possibly have him towards the end of the season?
Yeah, the frustrating thing with these is the answer would probably be yes to both of those. He's had a great career, and he's done amazing things, and I'm sure, if we were to look at x-rays of his knees or things like that or be able to examine him, we would probably see some kind of interesting arthritis or things like that. Again, I haven't looked at his x-rays or anything like that, but these types of things can linger, and most of it is kind of symptomatic control, and you may be able to tolerate game day if you modify your participation through the week or modify your workouts and different things like that to really work on symptom control. That's kind of more of the issue, and what level they can tolerate things. And if they've got a lot of pain and can't do it, it puts them at risk for injury because they just can't protect themselves. So, most of it's just symptomatic management.
Speaking with Dr. Trey Remaley of the Florida Orthopaedic Institute. And, Doctor, I know you specialize in hips, knees, and shoulders, and you do a lot of hip and knee replacement. I'm curious, when you're going into surgery, right, we talk all the time about pregame meals for athletes, and last year we asked a lot of the doctors what kind of music they like to listen to during surgery, but we're switching it up this year to the old pregame meal. So are there things that you like to eat before you perform a surgery, or more importantly, are there things that maybe you stay away from because you won't be able to go to the bathroom for a few hours potentially?
Yeah, that's a good point. Those cases can get long. Well, I do my workouts in the morning, so I go to the gym and do a 5 a.m. workout and try to get that done for the day. And then usually I'll have a protein shake or something after that. I usually don't eat a lot of heavy stuff in the morning just because it can tire you down and helps me keep my head clear and stuff. And I definitely want to try to stay away from sugars. Eating a lot of sugar before surgery can get the sugar crash, a couple hours later, and then not have the energy and stuff. And so, early morning I try to just to stick with a protein shake or a light omelet. Some of the hospitals around here make some pretty good omelets, so try to get one of those, and then make it through until I can get to a decent lunch.
What's the go-to omelet topping or filling, I guess?
Mushroom.
I'm not much of a veggie guy. I'm sure my wife won't be happy about that, but I like the sausage, the bacon. I do put some tomatoes and maybe some peppers in there, but I like an egg white omelet. It's a little bit lighter and less calories, though, so it's good.
Well, we really appreciate you joining us today, Dr. Trey Remaley, and this is the Injury Report presented by Tampa General Hospital in partnership with Florida Orthopaedic Institute. They provide you access to one of the top orthopedic programs in the nation. They are the best if you're dealing with any injuries. We had Dr. Remaley on right now. We've had doctors on before. They will be able to treat you. Just schedule that appointment today at floridaortho.com. Dr. Remaley, great stuff. We look forward to having you on again.
Great, guys. I really appreciate it. It was awesome meeting you guys.
Thanks,
you
Doc.
as well. Thank you. Oh, yeah, we forgot the doc. The doc. That's what we're calling
Oh, yeah.
The
The doctor. Thanks, doctor.
Great stuff.
He's like, what?
We love having the doctors on. We really do.
The doctors.
Every year, the doctors, because they do. They help people out. We've had listeners reach out to us before and let us know that they've seen them in the past or they've seen them since we've talked to them, and they're the best.